On paper, it's exactly what 1.2 million parents need right now. Childcare subsidies are increasing tomorrow. In reality, for some, the savings won't be noticed all that much as providers jack up fees to cover their own rising bills. For families with a household income of up to $80,000, 90% of costs will be covered. Those earning up to $120,000 will see more than 80% taken care of. Even parents who normally bring in too much money for government help will become eligible. Joining me is Paul Mondo, President of the Australian Childcare Alliance. Thank you for being with us. Childcare centres have been accused of raising prices to soak up the increase in subsidies, meaning a lot of parents won't actually enjoy much relief. What do you say to that?
Look, I think it's important to know that there are a couple of things changing tomorrow. And the first of that is the income test, which determines childcare subsidies and how the percentage is applicable to individual families. But also annually, there's an indexation to childcare subsidy rates. And that is a machination of the system, which is designed to absorb increases of costs year on year. And so I think from our experiences, what we can see is that most services are increasing fees in line with the cost of living and cost of operating expenses that have increased over that year. And most of that will be covered by this indexation figure, and we expect a significant majority of families to still benefit from the increase in childcare subsidies due to the government's new cheaper childcare legislation.
Some centres have been accused of price gouging. Do you think that is ever the case? Have you seen any examples of that?
Look, the ACCC has released an interim report this week which identified increases in our sector, and they showed that over the last 5 years fees have increased about 4% a year, and that's consistent across all service types and provider types in our sector. And now what we know is really clearly that the cost of delivering the service has increased immeasurably in that time and increased at rates greater than inflation there. And so what we're seeing and what the data shows is that is consistent. It's consistent across the sector.
As you say, that report said that childcare fees had outpaced inflation, with rises in some cases up to 32%. So people understand inflationary pressures, but what are specifically the other contributing factors?
I think it's important to know that when you read the report, it talks to centre-based daycare. Centre-based daycare is a traditional childcare centre as most families would know it. And it says for centre-based daycare that fees have increased 20% in the reference period. The 32% is for a different part of our sector completely. And so what it says that in that time we've had changes to our national quality standards, we've had changes to regulation in our sector which have increased what we do and increased the costs of what we do. We've had changes to some of the awards that outstrip the annual wage reviews and what have you. So that means that there is absolutely an underlying increase in cost.
That same report found that the number of centres charging above the hourly rate cap, which is the limit the government will subsidise for each hour of care, has almost doubled from 2018 to 2022. I assume for the same sort of reasons. But is that fair? You can understand why parents would be frustrated.
Yeah, so again, when we talk about what changes annually in terms of indexation for our childcare subsidy hourly rate cap, this year was the first time that actual indexation has kept up with the change in operating costs. This year it was 7-8%. In years gone by, it was 1.8% or 0.9%, which were actually 1/3 of the cost of the annual wage review increase in that particular year.
There is the issue of being accepted in the first place, especially in regional areas. Parents can find themselves on a wait list for years. What is being done to help that?
At the moment, absolutely, the regional communities struggle the most in terms of access to early childhood education. One of the biggest barriers at the moment is a lack of available workforce. In a highly regulated, high-quality sector, what we need is enough educators and teachers to be able to comply with our regulations. They're critically important regulations. We want to maintain those because they help deliver safety and the safety, health and wellbeing of children as well as good educational outcomes. But what that means at the moment is there are many services that are not offering the full number of places they have available just due to a lack of available staff.
OK, well, thanks so much, Paul, for your time tonight.
Thanks, Angela.